Hello everyone, you're welcome to today's episode of the Fertility Nurse. And in today's video, we're going to be talking about something very important. We are going to be discussing different infections that could lead to male sterility. What I mean by sterility is infertility. So, there are infections that, if left untreated, can actually destroy the sperms, making it difficult for a couple to conceive. I've talked about it in my previous webinars and all that. Infertility is not just a woman's thing. Infertility is both male factor and female factor, and they have equal share. But studies have shown that the males don't usually take up the responsibility of going for a check. So most times it's a woman that goes for the medical check. So the purpose of this video is to enlighten you so that you can understand that you have a role to play. If you're trying to conceive, you have a role to play as a man. You need to check yourself. You need to run some investigations so you can tell whether there are infections already in your system that could be leading to your inability to conceive. So we are going to the first on our list, which is the most commonly treated sexually transmitted infection, chlamydia. Chlamydia is the most commonly treated STI. So if you have chlamydia, which can be discovered upon an investigation, chlamydia can actually destroy sperms. It can actually slow down the sperms. Of course, when these sperms are obtained and examined in the lab, the chlamydia will not be seen in the sperm, but it's already causing damage. So what you have to do, you have to do the necessary check. If there is a chlamydia infection, you need to treat it, right? Good. So the next on our list is the HIV, which is the human immunodeficiency virus. It's popularly known HIV that causes AIDS. So HIV is a viral is a virus that can lead to the damage of sperms. It can actually damage the germ cell in the testis, leading to damage of the sperms and slow motility of sperms. So HIV, like it's well known, it has a treatment for it, although there's no known cure for it medically. So the thing is, if you have an HIV infection, you need to get to the hospital and then do the necessary checks and all to be sure that there is no other infection, because HIV has a way of suppressing your immunity, making you susceptible to other types of infections. So you get the necessary treatment and then you put on a plan that will enable you achieve your fertility goals. The next is similarly, because it's also a viral infection. It's called the HPV infection, human papilloma virus infection. This particular virus leads to cervical cancer in women. It leads to genital warts. It it leads to a lot of symptoms. Most times, the carriers of HPV do not know. Like, the carriers of this HPV virus are the males, so they do not know that they have this virus until after the symptoms have exacerbated or it has affected their partner. So you need to get checked for this HPV, infection, right? And young boy, as a young boy, if you have maybe a relative or you have a child that is still a young boy between 0 to 14 years, there's also a vaccination against HPV. There's also a vaccination against HPV for females too that are not yet sexually exposed. So this particular infection can also alter the sperm quality and the sperm motility. Another common infection is the gonorrhea infection, which reduces the sperm quality and also can lead to permanent infertility. So gonorrhea that is left untreated can cause scarring in the testis, can cause a lot of damage and lead to permanent infertility. And of course, gonorrhea is treatable and it is curable if the right antibiotics are being used. But you have to be very sure that The problem there is gonorrhea. You don't just go about taking, antibiotics here and there and all. And the last one we are going to be addressing is the mumps virus. Mumps virus. So this particular virus affects the sperms directly, and it can be prevented from occurring. That is why we have this the in the immunization schedule for your child. There is a particular time the child takes mumps, measles, and rubella vaccine. That is the MMR vaccine. So if a child takes this vaccine when he's supposed to take it, that child will rarely come down with mumps. But peradventure there is a mumps infection, it can also be treated and managed in such a way that you can still achieve your fertility goals. So, just in case you are, having it, you are having difficulty conceiving, it is very, very essential that you get your health checked. You go to the lab. You might not even really need to stress yourself about it so much. All you need to do is to get yourself checked, right? When you get to the lab, run all the tests, make sure that you have a clean bill of health, make sure that you're clean of all these infections before you even try to conceive, so you don't get into, you know wasted efforts, right? And just in case these infections are there, there is still a way out. Getting the proper guidance, getting the proper treatment will help you to achieve your fertility goals, will help you to conceive successfully. Yes, and there are cases where both parents are HIV positive, but their offspring are HIV negative. So that can also be achieved, but with guidance by a professional, by a qualified healthcare professional. So I hope you've learned something from this video, and I'm gonna see you in my next video. Just as I would say, I am rooting for the fertile you. See you then. Bye.